the topic of today is very important, very relevant. It's about the prostate health. Some people might think it's for men. It's not for only men, because we have sons, we have fathers, we have brothers, we have husbands, we have, in fact, men all around us. When they have one challenge or the other, the women are also having the challenge. Actually, what just happened, why this prostate was the topic we decided to choose, even though we had other bigger areas that would have attracted more crowd. I was sitting with a friend, and this friend is pregnant. I heard her quarreling and tried to report her husband to us that the husband has not been making love to her for a long time. You know, that was her challenge. That was her quarrel. And my husband and I looked at each other. She's pregnant. Eh? If the husband has not been meeting you, how come you are pregnant? It was a form of joke. But as we left there, the husband confided in us that he actually has a problem, because when he meets with her, he has a pain when he's trying to ejaculate. It was just obvious that, yeah, this guy, even though he's still in the minor state, is already developing a challenge with his prostate. He's barely 40, that is just in his early 40s, and he already has this challenge. That's to tell you that it is no longer about age. In those days, they used to tell us, oh, in the school or in her training, is that, oh, most men will always die of it or die with it at old age, because it's an old people's sickness. It's not a big deal that the prostate of every man will always enlarge. As from the age of 35, when the growth hormone starts to go down, especially when the testosterone, that the androgen that makes a man, is already going down, you will notice that it is a natural process. It is slow at that stage. Yes, before now, when men were men and a man could dig a hole on the ground with his urine, even at, you know, that young age, men were eating the right food and they could maintain their prostate even to old age. So before the testosterone starts to go down and the enzyme that, you know, destroy or make this gland not to be healthy starts to come in, the person is already in his 90s, 100 and something. But here we are seeing young men of 40, 30 something, you know, even 50, developing challenges with the prostate. See what is happening. Prostate cancer is the most common cancer in men and the second most common tumor diagnosed worldwide. The prostate, even though it's very small, it's as small as a walnut, you know, round, small walnut size, just beneath the bladder, urethra is passing through it. The challenge is not just about that pain. The man confessed to us that he couldn't get to meet his wife frequently because he's scared of the pain. So most times he would just sit in the parlor and be pretending to be reading newspaper, until he peeped, the wife has slept off, he would just sneak in and sleep. Bedroom problem, they call it the elephant in the bedroom. We need to understand what is going on, because what did we do that has solved that problem for that family? We just gave the Vitalize at high dose for the first 3 days. After that, reduced it to 4 for another 1 week. As I'm talking to you now, the wife thinks we are miracle workers, is happy, is praising us, sending us messages. Say, oh, if you were in Nigeria, I would have brought wine for you. We are like, why? She's not ready to say, but she's a happy woman now. Happy woman, happy family. That is what we are talking about. This small size, you know, gland is very, very important, because it makes some of the fluid that nourishes and protects the sperm. The semen that you see, the fluid is made from there. It is just behind the prostate, and this seminal fluid is produced there. The seminal vesicle, I'm not going to bore you with a lot of medical things, but I just want you to understand why it is very important. It's not just about urine passing through it. As you are growing older, and when the androgen or testosterone starts to go down, this prostate, this small gland starts to enlarge. You know, it's an inflammation. Just like if you have boil in your hand and the hand is inflamed, very inflamed, and they say, go and use that hand to cut grass. You can imagine using that hand now to cut grass. That's the challenge you also have when you have to use the reproductive system for anything at all, or the urinary tract for anything at all. Not only that, the urine going back when it is becoming so swollen and the urethra is now blocked and the urine going back, the person can have a lot of infections, a lot of challenge with the bladder, a lot of problem coming up. The person cannot urinate completely and all that. You will see that the family will also have problems. We are not even talking of the infertility or erectile dysfunction. Those ones will be small matter when it comes to the challenge that men really go through. So it is important we understand how it works, because the prostate cancer is almost like the breast cancer or cervical cancer to women. Women may not be able to have that challenge, or they may not understand what the man is going through, but it's a lot. Because 20,000 men die of prostate cancer, prostate enlargement, even after operation, the urinary consistency is a challenge. In fact, we can go on and on about the challenges. I just want you to understand that you are being of value to people that may not know that they have a problem. Some may not even know where their prostate is, because before now it was not a problem. If every minute 5 men are dying, or 5 men are diagnosed of a prostate, it means that it's a very, very big challenge we must attend to. So I have just summarized all that I explained. At 40, the hormone is going down, the prostate is getting enlarged, because the man probably before now did not follow up on what to do to maintain the prostate. Yes, family history can be a cause. I want to name some of the things that can make you predisposed, or that can make you know that, oh, you are a victim already. You need to get yourself diagnosed, or protect or prevent the enlargement from even starting at all. If you are 40 and above, that alone can be an issue, even if your parents never had it. But it is also worse for people whose parents or family members or brothers ever had it. Also, if the person is obese, that is, your body mass index is more than 25, you should check your prostate every year, or go on this recommendation we are going to be discussing today. Also, when you have somebody that have high blood pressure, or already has erectile dysfunction in whatever form, you should get the prostate checked from time to time, or take the opportunity to get it, treated. Prevention, they say, is better than cure. Or diabetes, or that the person does not exercise. There are some people that don't even know what they call Kenge exercises. Some men, they are above 60 or 70, they don't know what Kenge exercises is. They don't even know how to, strengthen the muscles of that area, or help themselves do the exercises that will prevent the prostate from enlarging at all. No talk of when prostate cancer starts to set in. As I'm talking, if you have any man, you have a boy, you have a brother, you have somebody you care about who is a man, who has prostate, who has a penis, who has bladder, please invite the person and say, please join, because by the time we finish today, you will know that you will thank God that God used you to reach out to that person. The problem today is that most men don't even know what to do, like I just mentioned. See, all I described, this is where it is located, underneath the bladder. You need to take care of it. So if all the minor symptoms can be bedroom problems, or they can be bedroom problems. I just mentioned one of the bedroom problems, not just the erectile dysfunction, but the pain the man will experience while trying to ejaculate. And after that, he will not like to go near a woman at all. Forget that they might be pretending that they have a side chick outside. Spend the time there, but you will be surprised that side chick just collecting money and the man is just running away. Also, if you notice that there's weak stream of urine, that's the urine is no longer digging hole on the ground, no matter your age. If it is not doing that, it's not powerful enough. Or you are washing your pants, and I encourage all men to use white pants, and you see yellow stain on your pants, it means that you don't always finish urinating and you think you are finished. Or sometimes you go to the bathroom to urinate, you have the sensation, but it's not really coming out well, or it flows for some time and stops. Flows for some time and stop. All these are just minor initial problems that you think, oh, don't worry, when I drink a lot of water. Some people, because they don't because one of the symptoms is also urinating frequently, and they don't want to go to the bathroom frequently. They are like, oh, let me not drink water. You're not drinking water will not make the prostate not to enlarge, because it's a sign that you're already having the enlargement. So urinating frequently, also painful urination, that is, the person is trying to urinate, there is pain. Before blood is entering the pee, it means it has already gone to, serious matter. So we need to understand that the signs and symptoms can be mild, or can be can be covered up by any other sign or symptom. But it is important because of the way it's claiming life. Because if you even go for the operation or go for the drugs that are used just to make sure that, oh, they open up the urethra more, or they shrink the muscles around the urethra, or you take all those drugs, anti-inflammatory, you see, it's only temporal, and the side effects it's not what you wish for your enemy. So it's always better to know what are the food, what are the nutrients, what are the nourishment, what are the things you're supposed to do to prevent it from happening at all. Or if it has already started, you have signs or symptoms, what are you supposed to do to reverse it? And what will you do now to maintain it? Those are the major things we are going to be talking about. We have mentioned the bathroom problems, the bedroom problems, and how you can, prevent the urine retention, because even if you don't go to urinate, it means the bladder is getting challenged, then up front is getting to the kidneys. And once the kidney is damaged, you all know very well that it is a big problem that we should not wish even for our enemies. I will just mention some of the things, even though it's not on this slide. Now, I just want to first mention the kind of things you should avoid if you don't want to develop, prostate enlargement. I'll mention the prostate cancer when I'm done with it, but because it's actually even the simpler form of where it starts from. If you take the congestants a lot, I have cold and catarrh, just go to the chemist and buy any of all these. There are so many now. In fact, there are so many, you can't even mention them. Just know that you have started working towards the prostate challenge. Or you take all these antihistamine, that's to prevent allergy and all those ones, you take them a lot. I'm not talking about maybe natural food or food supplements like vitamin C and all the rest, but if you are taking any antihistamine frequently, taking the congestants, all this cough, cold, catarrh form of drug, or you take a lot of caffeine from time to time, like all this coffee and all that, you are the type that drink alcohol a lot, so you lose a lot of zinc, especially some men that are, let me call it, mentally not so arranged in their sexuality. They are over sexually active, so they release zinc all the time. They also drink alcohol and release zinc all the time. You can be sure that person will develop prostate as fast like lightning, because the more zinc you lose from the system, the more you are, like you are going to develop the prostate enlargement. But if you are the type that also take maybe food or nutrient that contain the zinc, well, this might not be a problem. So don't get me wrong by thinking that, oh, men who are sexually active will develop prostate. No, if it was so, it means people who are celibates or reverend fathers will not develop prostate. Of course, the research has shown that all way around it happens, even though you are not sexually active. Once your testosterone starts to go down and the 5-alpha reductase, which is an enzyme that helps to, let me say, causes the processing of that androgen testosterone, which makes you a man. Once it sets in, you will see that the prostate will enlarge on its own. There's nothing you can do about it. It's not anything you can stop. But there are things God has put in place, put in the food you're supposed to eat constantly. That was why in those days when we were so close to nature, when we ate all these things like, the healthy food, like normal business, prostate complications were not a thing to be talked about. But now, with the kind of food we eat, the processed food we eat, the mileage, the production, the fertilizer, the kind of things we eat these days that don't contain any of these nutrients I'll be talking about. That is why we have this boom, the blow up of prostate enlargement. And only man can help himself come back by taking this nourishment from the day. Even as you are growing up, if you have young men, put them on this nourishment from time to time. Somebody asked me, if I don't want to have prostate, how often should I take that? I say, yes, 1 to 3 months every year, just take this nourishment. There are about 6 to 7 of them that are very, very important. Very, very important. There are other ones you can use as adjunct therapy, even if you are already carrying catheter, or you already having the challenge, or you've already done the operation, you've already removed the prostate. You still need to maintain your healthy bladder. So therapeutic nutrition is what I am suggesting as a pharmacist, having seen a lot of side effects with the other drugs we use, because I know, yes, we can give the drug we call alpha blockers, we can give this ADEF5 inhibitors or alpha 5 alpha reductase inhibitors to either shrink the muscles or open up the urethra, or give diuretics to help the person urinate more frequently. Sometimes we combine them together. But like I said, the side effects of these drugs is what we want to avoid as much as possible. So the prostate gland, the nutrition and optimal health is what we are after. And these are the nutrients. You can look for food where you can get lycopene. A lot of people know that you can get lycopene from where? You can quickly type. I know Daddy has given you a lot of training on this. You can quickly type it on the house and get something today. Lycopene, where do you get it from? Tomatoes. Nobody got that, so I will just go ahead. Omega-3, where do you get it from? You get omega-3 from cold processed olive oil, or your salmon, or cold sea, fish. But once you heat them up, they are easily denatured by heat. That is why only FFP and some other companies who are able to do the very expensive process of co-stabilization process, they are the only ones that are able to produce these omega-3 and omega-9 fatty acids that really is able to be effective. Other ones are not effective because most people just use heat to extract them. Yes, the omega-3 will be there, but it has already been denatured. Of course, the vitamin of the B group, the folic acid, the potassium, selenium, and vitamin E, iron, and the soluble fiber you need, and zinc. But of all these, the most important are the 6 to 7 I mentioned: lycopene, omega-3, folic, B12, the vitamin B group, potassium, selenium, iron, and zinc. Yes, folic acid and fiber are not like necessity, but they help if you can always get them in the food form, in the natural nutrient. That is, like FFP has done, what they have done is to micronize this food, call it automolecular nutrition. That is, micronize them, make them in their absorbable form. So they are ready to just get absorbed without really passing through all the processing and all that, but they get to their site of action in their usable form and effect a therapeutic change or therapeutic benefit that we desire. These are micronized food nutrients. So the zinc is from food, but it's micronized in its absorbable form. The omega-3, the lycopene, all the nutrient that you need is contained in one pack we call Vitalize for Men. This Vitalize for Men is an amazing supplement that we all need. Not all women, or women will have Vitalize for Women, but this one, Vitalize for Men, like I said, if the man already has challenges, some of these symptoms or any of the symptoms I mentioned earlier, just put the person on this Vitalize 2-3 times a day, normal dose, until all the signs and symptoms are cleared. But if the person is already having pain during ejaculation, or the urine is already flowing and stopping, or the person is already having frequent urination, or the person has gone to do the PSA and is already above, 10 and above, you will definitely put the person on high dose of this Vitalize. The minimum will be 5 times a day for the first 3 days. Most of the time, by the third day, person, if the person is already on catheter and all the rest, you see that the person will be able to urinate naturally or normally. But maximum, this 2 times a day for a week, we actually bring down the inflammation, and the person is able to urinate normally. After that, you reduce the dose to 4 times a day for a month. Then the person can now continue with 2, 3 times a day. If you treat the person for between 3 months to 6 months, you can be sure that person will recover completely. We encourage you to add berry nectar because it helps with the urinary tract infection, or in case the person was already retaining urine and all that. And we encourage you to add multi-marker to help the erectile dysfunction, and because it will also help the urine flow. It contains our gene and so many other ones that will help strengthen the muscles. And B poly that contains all the B group. It also contains zinc. Our Vitalize contain all of them, but we are trying to boost this person's healing. But the person doesn't have challenge, only Vitalize to prevent, only Vitalize and berry nectar, because our aloe vera gel helps to transport this nutrient to their site of action, because it helps every useful nutrient you need to penetrate up to the 7th layer of any tissue. It means that you will get value for your money. But if the person already has cancer, or has, the person has gone for biopsy, or maybe the result or the person wants to prevent it, that's when lithium is important. Lithium is only when the prostate cancer has been identified, or the person is afraid not to have it. So Forever Vitalize is men's vitality supplement. It's very important for the prostate, but also it helps the man to maintain his erection, to have good relationship, all the vitamin, mineral, trace element that the man needs to be strong, to have energy. Even if you want to do like how many rounds, 10 rounds and all that, you will need a Vitalize and multi-marker. I remember one of my friends they were going on, let's use the word honeymoon, though they have been married for more than 10 years, but they just wanted to have fun. And the husband secretly came and bought Vitalize and Aggie Plus and what was it? Fab, Forever Fab. Then the woman called me some few days after. I said, which drug you give my husband? I said, when we were going, I said, you should buy, you should also have some. It was so much fun, it was so funny and all that. But what I remember is that it is better than all the other pills, blue pills and the rest that have side effects that can affect the heart. But this one will help the heart muscles, but it will also help you to be a man throughout life. So that's why we call it the macho man. If you want to be a macho man, want to remain manly forever and throughout your life, definitely we need the Vitalize, multi-marker, and maybe from time to time, especially if you're the type that exercise a lot, you will need it with your Aggie Plus. Remember, I also mentioned that as you are on this product, you also need to learn what we call the Kenge exercises. During our C9, our fitness coach was there to teach us, to train us on what the Kenge exercises. If you don't know, you can reach out to the person that invited you here today. We don't only just give you products, we will show you lifestyle modifications that will help you recover all parts of your body. So even as you're restoring your health as a man, every organ in your body, you are getting them restored. We will show you how to eat, how to take your water. Some want to drink water, they will finish a whole glass at once. No, the more that's frequently, but not too much at a time. Healthier. You do the exercises and add Kenge exercises and add muscle training exercises and cardio, that is cardio exercises that help to increase the strength of the heart. All these are lifestyle modifications, and the kind of exercises that will that will activate all the process of the body, that will pump endorphins into your system and all. These are the things we teach, we train, that will help you not just to be healthy, but when you make the money, you'll be able to enjoy the money. So the vitamins that you need are all in the Vitalize. If we are going to post these explanations, what lycopene and all that on the platform, please, you can screenshot and share with all men. We want all Nigerian men to be as healthy. In fact, the health of the nation depends on you and I. If we don't give out this information, you you will see a challenge might come up around you, and you will only be saying, oh, I wish I knew, I wish I knew. Oh, I was talking to this man, why didn't he listen? All these are important vitamins for the prostate. The sulfur metal, the magnesium, the zinc, the selenium, everything has been extracted naturally from plants and organically produced. No fertilizers, no herbicide, no chemical. We have got all the certification from America and all the leading countries, even from Israel, from the Muslim world, the kosher rating and all. Got them all to tell you the extent this company goes to make sure you have the best of the product. I hear a lot of products have just arrived, especially the new perfume now. I think a lot of people should be able to just do their OCC on the perfume. It's amazing. Just get the perfume for men, perfume for the woman, vitamin D now. So yummy. And we all know that in our generation right now, post-COVID, everybody needs vitamin D. It's taking a risk if you're not taking that vitamin D. So multi-marker, I also explained, we all need it.
Now you not tell me.
You see, it is what every man will need to enhance stamina, energy, and sexual function. You will definitely be moving away from erectile dysfunction if you decide to take your multi-marker from time to time. The good news is that this particular one is for both male and female. So all the women, they are not left out. You need energy too. I think the women need it more than the men, because outside the bedroom challenges, you also go to the kitchen, you take children to school, you do a lot of things, but you need the stress, especially with the kind of stress in Nigeria right now. You need multi-marker to help you with the energy and the anti-stress, the one that will help you to remain strong throughout, so that when it is all over, you are still there to enjoy the goodness that will come from this post suffering. Somebody said there's light at the end of the tunnel, and I remember with myself, somebody answered back and said, what do you need light for? At the end of the tunnel, the sun is shining and there's light everywhere. I need the light inside the tunnel. So help yourself now, because you know multi-marker also contains allergen. So if somebody doesn't like the sweetness, some people don't like something that is very sweet, though it's all plant grade that we have in our Aggi Plus. L-arginine that gives you the nitric oxide to strengthen the heart, for blood vessels, dilation, and to even maintain erection, or for the man or woman to be strong, to do exercise, to get up to your 10,000 steps on a daily basis, and not get fatigued at all. It's also present in multi-marker. So if you don't want the sweetness of Aggi Plus, just take 4 multi-marker. Is equivalent to 1 sachet of Aggi Plus. So multi-marker is important. Lycium Plus, like I mentioned, especially for those who already have challenges with the cancer issue. You see, prostate cancer is also a challenge, and even after operation, challenges sometimes also follow, not just the inconsistency of urine and all that, or carry urine bag around, but with lycium, it will also help to ameliorate the side effects of all those radiations that you go through, and all those, chemotherapy, radiotherapy, and all the rest. So we use them as adjunct therapy. They are not alternative medicine. They are not something that will replace what the doctor is recommending for you. No, they are food. It's just that they will not help you to recover better and faster and more complete. You get your desired outcome. The active ingredients, especially the licorice extract and the elated, which is goji. Just Google goji berries. So I'm talking to you now, goji berries, and see what it does for every human being. I personally don't play with that. I take this lycium every day, so I can get all the wonderful benefits of goji berries. There are no goji berries in Nigeria, but the world has become a global village, and we can all get what we want. We need them. Okay, I've summarized them here. You can just take a screenshot, send to your friend. Say that this goji berry, this is what you can do. If you ask, how do I get the goji berry? Just send lycium, and you have started with your marketing of 2 case credit. Don't forget, we all need these products on a daily basis. So immune blend is recommended also when the person already has challenges with the prostate and if it's cancer. So these are products that will help you support your recovery. Propolis is anti-inflammatory, it's antibiotic. Remember what I mentioned about infected bladder or kidneys or inflammation that is already happening. Propolis will be taken 3 times a day to reverse, prevent, and restore your prostate gland and embrace, and even at old age, maintain relationship. Therapeutic nutrition is your best bet. If you agree with me, say, yeah, amen, we have come, so let us protect our prostate and it will be well with all of us.